Hi, my name is Francisca Debrah Grant, and today we'll be looking at understanding mental health, major sources of stress, and effective coping strategies. So, this presentation will be defining mental health and its importance, major sources of psychological stress, effects of psychological stress on individuals, coping strategies for reducing stress, assessing the effectiveness of coping strategies. Defining mental health and its importance. Mental health is a state of a person's overall emotional, psychological, and social well being. It influences how individuals think, feel, and behave, affecting their ability to cope with everyday stresses and maintain relationships. So, the importance of mental health. Good mental health allow us to live fulfilling lives, build strong relationships, contribute to communities, and handle life challenges with resilience, work productively, and then help us to realize our full potentials. Major sources of psychological stress: work related and academic pressure, high expectations. So, challenging goals and the need to perform exceptionally well in jobs and studies and schools situations can make people feel stressed. Tight deadlines, strict deadlines can be overwhelming, increasing stress as individuals rush to complete tasks within a specific time frame. So, impact on mental health. Unmanaged pressure can harm mental health, leading to anxiety and burnout in work or studies. It is important to acknowledge and deal with this pressure to stay healthy. Interpersonal and social challenges, relationship conflicts. When people in a relationship argue, it can cause emotional strain and significantly impact their mental health. Social isolation effects. Social isolation can lead to feeling of loneliness and stress, which can be detrimental to one's emotional state. Communication difficulties. So communication difficulties can lead to misunderstanding, which in turn increase emotional strain and stress. Life events and major transitions. So, stressful life events, major life changes such as grieving a loss, can trigger considerable stress and emotional difficulties, which can lead to significant stress. Adjustment and adaptation. So, adapting to a new circumstance requires psychological adjustment and coping strategies for well being. Resilience for mental health. Developing resilience help maintain mental health and effectively cope with impact of stressful transitions. Psychological stress. Psychological stress is a normal response of your body to adjustment or difficulties. It can cause a variety of physical, emotional, and behavioral reactions. Experiencing stress is common and unavoidable. However, using stress management strategies can assist in coping effectively. Stress can be experienced in a negative way, feeling anxious about having an operation, or a positive way, for example, working hard to improve productivity. Acute stress. Acute stress, which is an ongoing sensation experienced intensely for a short period and then gone. An example is a tense moment during a disagreement and attending a job interview. Acute stress includes anxiety, depression, concentration difficulties, and disturbed sleep. Episodic acute stress. This is common in high pressure jobs like in healthcare, where individuals are in a state of alert. Poor time management and organization, relationship difficulties are a common cause of episodic acute stress. Its effects could lead to changes in behavior. Example, changes in eating habits, either overeating or undereating. Substance abuse, reliance on alcohol and drugs, physical effects such as headache and migraines, fatigue and sleep disturbance. So chronic stress occurs when a persistent burden lasting for weeks or months is due to ongoing problems such as job dissatisfaction, relationship troubles, or financial worries. The effects of chronic stress can elevate blood pressure and heart rate, leading to increased risks of heart attack or stroke. Stress hormones also damage arteries, contributing to plaque buildup. Addressing the alleviating chronic stress is vital for maintaining good health. Traumatic stress. So, experiencing a traumatic event like physical assault, severe accident, or natural disaster can trigger intense fear of death or serious harm, leading to significant stress. This stress can develop into psychological conditions such as PTSD, with potentially enduring implications. Coping strategies for reducing stress. So active problem solving. So engaging directly with stresses by identifying and resolving problems effectively. Time management. Using planning and schedule techniques is essential to prevent the stress of feeling overwhelmed or facing tight deadlines by implementing time management. Limitations. Over reliance on active problem solving can lead to increased stress of issues or complex or beyond one's control. Time management, while useful, can falter when unexpected events or urgent situations arise, disrupting carefully made plans. Seeking information, although valuable, unclear guidance can intensify worrying, aggravating more stress to the individual. So emotion focused coping approach, relaxation techniques. So relaxation techniques and calming exercises help reduce stress and anxiety within the mind and the body. Mindful practices encourages awareness of the present moment, helping manage emotional responses effectively. Positive reframing. To cultivate resilience, embrace cognitive strategies such as positive reframing, which shifts your perspective on difficult situations, making them feel less daunting. Limitations. So while this technique is beneficial, it may excel at soothing immediate emotional responses but might not resolve the underlying issues. For instance, while deep breathing can calm the nerves, it may not tackle the underlying source. So it may not further equip individuals to effectively navigate overwhelming emotions. Seeking social support and professional help. So, social support, having a strong support network such as friends, family, or support groups offer both emotional solace. Friends render emotional comfort and understanding. Limitations. Gaining access to experts in mental health can be limited due to financial costs, geographical barriers, and shortages of mental health providers. Support groups may not always cater to specific individual needs to address the underlying source. Family and friends may often be constrained by their availability. In conclusion, the effectiveness of various stress management strategies is contingent upon individual preferences and circumstances. Physical activity offer quick relief for acute stress and mood improvement. Relaxation techniques are good for daily stresses, while social activities and hobbies provide distracting and connection. However, cognitive behavioral therapy requires professional guidance and does not suit everyone, especially for chronic stress. Ultimately, the best approach combines a variety of personalized techniques to reduce stress effectively. Understanding mental health is challenging and its challenges and effective coping strategies is vital for well-being. Tailoring coping methods, seeking support, and building resilience can empower individuals to manage stress and maintain good health. Thank you.